my role is to kind of thank everybody for the blessing that the center's had in kind of establishing the agenda for the first 5 years. I thought that Phil's comments are, the center has been around for 28 years now, and our work is to raise and respond to ethical issues in health and healthcare in the community and throughout the nation. But in Kansas City, which is really where we do our practical work, our work in the community and the neighborhoods, aging and end of life has obviously been a fundamental area of our work. But this particular initiative, which was started about 6-7 years ago, I guess, as we kind of hatched this idea, quickly became, for me, as the primary lead representative from our organization, far more about the community than it is about health and healthcare. The example that was given this morning, Rita is my mom, and she does have 6 kids, and 2 of them are, I used to be one, there used to be 3 of us in the area, and now there are only 2 in the area. And she quit calling me a few years ago because I was so busy, and I wasn't necessarily responsive. And that's not okay for her. She's 85, she lives by herself, and she's told us all that we're going to cart her out in a casket because that's the last place she's going to live. And she made a promise to her husband for 26 years that she was going to care for him in her home, and she did it till 4 days before he died. And that's what this initiative is about, is how do we build these communities to allow us to care for people where they want to stay, as long as they can stay, and in some cases until we cart them out in a casket. And that's not going to be an easy task, especially in the challenges that we face in an area where urban sprawl and cheap land keeps pushing the boundaries out. We cannot create sustainable infrastructures by building more roads and more cul-de-sacs and, more areas that are separated, as we've heard today, from where people want to be and share their lives. And I've really appreciated the perspective today, because being in the trenches for the last 5 years with Kathy and all the other folks who've been working on these initiatives, and we've had tremendous leadership from the aging services community. It still gets frustrating because, and not to take pot shots at the Star, but there's this piece from Steve Rose about the fact that we all love our Johnson County suburbs with our cul-de-sacs. Well, I live in Johnson County, and I live on a cul-de-sac. And this last week, for the first time in 35 years, my wife had surgery, and we went home, and she's trying to recover from that surgery on crutches and a walker. We don't have a front porch. We got a long ways from the front steps to the car unless we go into the garage, which is how we go in and out of our house. So everything that Phil described is isolating me and my wife, who are the only one. Now our kids are around, but they're not close either. Isolating us from what we really want. So whether it's Peter Pan syndrome that we have to face, or the fact that we all believe that we live in Disneyland and we can stay there forever, it isn't true. And we have to come to grips with the fact that the neighborhoods that we've got established need to convert, and we've got to also think about ways of establishing new relationships with the folks that we need to be able to rely on and provide the support for the families that want to stay there. So there's 3 things I want to leave you with. One is, and this is based on the research that Phil talked about and that we've also spent a lot of time over the last 5 years learning about, is that social connectedness, the social interactions, enhances health status and provides the necessary network for caregiver support. So whenever you're planning on doing anything, and this is to the city planners and the elected officials, is social connectedness is the single most important thing to consider as we age, as an aging society. It's giving people the opportunity to stay connected socially. It helps with depression, it helps with physical status, it helps with function. It makes a difference. So think about how social, and David's group Mark does this all the time. These people live in this world and they think about it all the time. And most of the data that we were able to pull together over the last few years with the help of David Renz and others came from Mark too. And the challenges that we face in getting folks to understand that we're all aging. I mean, we've got economic numbers that want to keep us focused on the fact that we got young people moving into our area and we're going to continue to build more soccer fields and that kind of stuff. But I got to tell you, it's not just about soccer fields. It's about staying connected to the people who are already there, we talk about the 50 rule. The 50% of the people who live in a certain area, that 50% of the folks who live there are over the age of 50, and the housing stock is more than 50 years old. There's a lot of those neighborhoods in the Kansas City area. That 50 rule has got to be paid attention to, and we've got to figure out ways for us to do it. And we've designed, in the initial days with Nichols, there was a great process put in place to create neighborhoods that had identities, that had the social structures and the economic structures to be able to continue to provide support for those people as long as they were able to stay in those areas. And those are good things. But we don't necessarily have that in the outer areas, but we do certainly have it in the inner city. And community involvement at the neighborhood level. And this is one of the areas I think that we face a challenge for. This is kind of the future. We really never got that going in the first 5 years. That is the next step. And David's group is going to help us be able to figure this out. Is how do we connect with neighborhood associations and the neighborhoods that are going to help solve this problem? And we've got some good examples of that happening already. But those communities and those neighborhoods should be guides for economic development as we move forward. And so the mantra that we've tried to put out there is that we have got to, in the Kansas City area, talk about smaller, denser, closer in. Urban sprawl is unsustainable over time. Now, I live in Lenexa, next to Olathe, which is close to Overland Park. And we all love to spread out down there. But we can't spread forever. And we've got to figure out ways for us to be able to build that community back in and come back into the first burbs, come back into the donut ring around downtown, and figure out ways to fill that in, and then to work on transportation issues and mobility issues to help with that. So smaller, denser, closer in, sidewalks over sprawl. And the point that I think David made at the end and Phil did too, that intergenerational living over isolation. When in the 50s and 60s, when we started moving to the south and the snowbirds and everybody was kind of out, migrating out from the north and down into the southwest into Florida, there was this notion that, you were going to be able to inherit mom and dad's condo in Florida in the next 20, 30 years. And what they're finding out in cities like Philadelphia and other places is that mom and dad didn't die. And now at 70, you're ready to take over that condo, and mom and dad are moving back to Philadelphia. And this actually happened in some of Mia's work. Mia Oberlink and Penny Feldman and David Phil were looking at this. And they found out that the city of Philadelphia didn't plan for this. They didn't plan for people to come back. The people were out migrating and they were supposed to die in Florida, and then their kids were going to move out. And that didn't happen. And in Kansas City, we may not have that issue, but the urbanization of the elderly is going to happen to us too. The resources that are necessary for us to be able to sustain ourselves as we age is primarily a function of how close things are. Proximity is important. So people are going to move in to the Olathes and the Overland Parks, in addition to the fact that those of us that are there are going to want to stay. So, and it's important to have kids around. One of the things that happened when these people moved into these kind of elder ghettos, as you might, with the walled communities around them, is that they soon began interviews with women especially, who said, I miss the kids. I miss having children around. Now, we thought we were moving into the leisure years and all we want to do is, get on the golf course and play 9 holes or whatever. But we missed the playgrounds and the noise, and where are the children? And we've got that here. We can figure this out if we pay attention to those things that matter. And I am so encouraged with the leadership that Mark is going to bring to this, because this is not about sickness and illness and dying, if you will, from the work of the center. This is about living as completely as possible and as fully as possible as we can. In conclusion, I just want to say, a few weeks ago, we sponsored a workshop on the symposium on the ethics of transitions of care and how poorly we do the handoffs between hospital and home and that kind of stuff. And this is major work that we've got to figure out in healthcare as we move ahead. But what we talked about as the solution and the challenges that we face were how do we take the narrative ethics that Phil gave us today and weave those into commitments around community. We talked in that workshop about love, and we talked in that workshop about compassion, which has nothing to do with Medicare reimbursement. It has nothing to do with, home visits. It has to do with community and families and people reaching out to one another and making those efforts to make sure that jug on that porch is filled with water for the lady next door. Those are the things that are going to matter. And Kansas City is one of the most hospitable, friendliest communities in the nation. We can lead this, and we can do it right, but it's going to take all of us working together to make sure that it happens. And I look forward to working with Mark and everybody else in this room to make sure that we get that done. Thank you.